If you look in the mirror and you feel you may need a minor touch-up, a minimally invasive lunchtime procedure may be just what you're looking for. Our makeover candidate experienced how a few quick enhancements could add some pizzazz to your look. Aesthetic medicine has come a long way. What we were doing 2 years ago, we're doing a little differently today. And Dr. Muhn can tell us all about that. Master dermatologist.
Hello.
Does a lot of work with me. Very nice. And Sue, our patient today. So we're going to be talking about restoration, volume restoration, because we deflate a little bit as we get older.
That's right.
And maybe what we can do about some lines.
Well, you bring up a good point. That's how things have changed. It's now about addressing the reasons why we're aging, so restoring the volume of why we've aged. Now, if you take a look at Sue, she is very young looking when you look at her. And one of the reasons is she has nice full cheeks. That's an area of volume she's not lost. But she has lost in these areas called the nasolabial folds, as well as the marionette lines. She's developed what's called the smoker's lines, although we know that she doesn't smoke. And these are the lines that come up here. And loss of the lip, that often happens. So we're going to improve all of this with some of the new techniques that are around. We'll put some Botox or muscle relaxants in here, and it'll raise the eyebrows a little bit, give a nice, alert, perky, confident look, and that will add and balance the rest of her face, because she's got fantastic framework from which to work.
Fantastic framework, Susie. And then after, we're going to take you and we're going to get your hair done and have a complete hair and makeup day. Exciting! Yay! Okay, good. Thanks, Dr. Muhn. Why don't we get started?
Okay.
All right.
Let's do that. Tiny, tiny little needle. Feels like a mosquito bite.
It does. Feels like a mosquito bite. Little thing like that.
Right. And this is going to relax some of those muscles that pull down, give us an angry look or excessive lines. And it's a great softening technique. Now you notice that I'm rubbing and I'm pushing. You don't get to rub or push. That's super important.
Yeah, very important after the muscle relaxants. Don't touch it with your hands because you can move it around. You want to relax other muscles.
Right. You want to keep it where it was designed to go.
Where it's designed to go.
Right.
We're going to the hyaluronic acid, right?
Yeah, we're going to do the hyaluronic acid.
And
we're going to use Perlane on this area.
Nasolabial folds, right?
Exactly. You could be an anatomist.
I know. I've been doing this for 3 years. We're in our third season. Okay, and a little bit of the lip line, right?
That's right. So we're going to focus on this area here, strengthening some of her lip, and actually going after some of these small, fine lines. And then finishing off in this region. And it's a wonderful touch.
So by putting in the injection Perlane under here, it kind of just lifts it up? Is that the idea?
That's exactly right. Loss of volume down here. Now what we're going to do for her is address some of these vertical lines, these smoker lines, even though she's not a smoker, with a small-based hyaluronic acid.
Oh, okay. All right.
So one of the things that makes us look a little bit hollow and the lines, the bags beneath the eyes more prominent, is the hollowness beneath that. So
Susie's looking pretty good there. She's a little red around here.
Yeah, she was fantastic. Those 15 minutes, and she was absolutely fantastic. Some of the redness that you see is from injections immediately, and that goes away quite quickly, usually within 20-30 minutes.
Okay, well, good. So we're going to take you into hair and makeup next week. Ooh, exciting stuff. Thank you, Dr. Muhn.
Pleasure.